Hi, my name is Kaylin Silvera, and this is my Chemistry and Careers Project interview. You can go ahead and introduce yourself now.
Hi, my name is Paris, and I'm a dental hygienist.
Okay, for the first question I have, what inspired you to become a dental hygienist, and how did you know the career was right for you?
I've always had an interest in healthcare and helping people, but what really drew me to dental hygiene was the opportunity to build ongoing relationships with patients while focusing on prevention. After shadowing a hygienist in high school, I realized I loved the blend of science, hands-on work, and patient education. That experience confirmed that this field was the right fit for me.
Okay, and then what steps did you take to become a dental hygienist? And what advice would you give someone currently prepping for dental hygiene school?
I completed my prerequisites, which included anatomy, microbiology, and chemistry. I then applied to a competitive dental hygiene program. After graduating, I passed the national board exam and a clinical licensing exam. My biggest advice is to stay disciplined with your studies, practice your clinical skills as much as possible, and find a good support system. It really makes a difference when school gets really intense.
Okay, and then I have, what are the most rewarding and most challenging aspects of working as a dental hygienist on a daily basis?
The most rewarding part is seeing patients make progress with their oral health, especially those who start off anxious or unaware of proper hygiene. It feels great to know that you're making a positive impact. The most challenging part is managing time during busy schedules, especially with patients who require more attention or have dental anxiety.
Okay, and then for the last part of this one, I have, how do you stay up to date with new techniques, technologies, or practices in dental hygiene?
I take continuing education courses every year, following dental hygiene journals, and attend professional development seminars when possible. Technology in dentistry evolves quickly. Things like laser therapy and digital scanning are becoming more common, so staying current is key to offering the best care.
Okay, for the next section, they're like science-based, so I have, how has your understanding of human anatomy and physiology helped you in your daily work with the patients?
It's crucial. Knowing the anatomy of the head, neck, and oral cavity helps me accurately assess conditions, identify abnormalities, and perform thorough cleanings. Physiology helps me understand how systemic health issues like diabetes or heart disease can affect oral health.
Okay, and then how important is psychology or communication science in building trust with patients and helping those who experience dental anxiety?
It's actually extremely important. Many patients avoid dental care because of fear or bad past experiences. Being able to recognize signs of anxiety, communicate clearly, and create a calming environment really helps build trust. Psychology helps me understand patient behavior and how to motivate them to improve their hygiene habits.
Okay, and then what scientific courses did you find most challenging or useful during your education, and why?
Physiology was one of the more challenging courses due to the detail and depth required, but it was also incredibly helpful in understanding how oral health connects to the entire body. Microbiology and anatomy were also very relevant, especially for understanding infection control and disease transmission.
And then in what ways does biology play a role in understanding gum disease, plaque buildup, or oral infections?
Biology helps explain how bacterial colonies form plaque and tartar, how inflammation affects gum tissues, and how the immune system responds. Understanding the biology behind periodontal disease allows me to explain it more clearly to patients and tailor treatment plans to their specific needs.
All right, and then the last 4 questions are just chemistry based. How does your knowledge of chemical compounds and products like fluoride, whitening agents, or anesthetics help you educate or treat patients?
I often explain how fluoride strengthens enamel by replacing lost minerals, how peroxide and whitening products breaks down stains, and how local anesthetics like lidocaine block nerve signals to prevent pain. Understanding the chemistry behind these helps me educate patients and make safe, personalized recommendations.
And then can you explain how pH levels in the mouth impact oral health and how chemistry helps you assess or treat imbalances?
So the pH in the mouth is important because when it drops below 5.5, enamel begins to demineralize. Acidic environments from sugary diets or certain drinks promote tooth decay. Chemistry helps me understand how to recommend products like fluoride, toothpaste, or pH balancing rinses that neutralize acids and support remineralization.
Okay, and then were there specific chemistry courses or topics that you found especially relevant or helpful during your training?
Yes, general chemistry and biochemistry were both very helpful. They gave me a better understanding of the chemical makeup of plaque, like how certain ingredients interact in dental products and how the body processes medications. Knowing the basics of acids, bases, and chemical bonding has come in handy more times than I've expected.
And then for the last question, how do chemical reactions such as those that occur with plaque and tartar buildup influence your approach?
When bacteria and plaque digest sugars, they produce acids as a byproduct. These acids demineralize the animal. Over time, minerals from saliva can react with plaque to harden it into tartar, which requires professional removal. Knowing these reactions helps me explain to patients why daily brushing and flossing are critical and why regular cleanings are necessary to remove calcified buildup.
Perfect, thank you.